So why do you want to be a PA? It seems like an easy question, right? You want to help people and you like science. But there's a problem with that response. It applies to almost every healthcare profession there is, and it even applies to some roles outside of patient care, like being a clinical research coordinator. So how exactly do you answer this why PA question that's at the heart of your personal statement and your entire application narrative? Hi, my name's Ryan Kelly. I've worked in the admissions consulting business for over 8 years. I've helped PAs get in all over the country, and along the way, I've developed 3 key strategies for helping them articulate their dreams. Let's go over those strategies today so I can help you convince admissions committees that being a PA is singularly the right career for you. Let's talk about the first key strategy for answering why PA, and I like to call this confirm by contrast. Essentially, there's an unwritten question behind the why PA question, which is why not doctor and why not nurse? It might be kind of annoying to answer these questions considering you've probably been bombarded by them for years from your professors, your mentors, and your friends. But if you don't explain why you're choosing PA over MD, NP, DO, RN, or other healthcare professions, it's going to be hard to convincingly and compellingly answer the why PA question. So that begs another question. How exactly is being a PA different from a doctor or a nurse? All right, let's start with the differences between being a PA and an MD, because doctor is usually the career that people bring up when you say you want to be a PA. I think there are 5 reasons why you might want to choose the PA route instead. The first is that PAs spend less time in the classroom. The second is that they have a shorter training timeline than an MD. The third is that they spend more time on patient care itself. And the fourth is that they have more flexible careers. And lastly, they work shorter and more regular hours. All of this means that you'll be able to more readily treat patients, you won't fall into as much debt, you'll have more face time with the patients themselves, and you'll be able to achieve a better work-life balance. Okay, what about the difference between being a PA and an NP? I have 2 main reasons to make that distinction. The first one is that there are fewer barriers to entry in being a PA. Nurses have a much more incremental timeline where they might need to achieve multiple degrees and certifications before they can work as an NP. Whereas as a PA, you do the 2 years of training, you get some work experience, and you're in the field. The second reason for PA versus NP goes back to what I was saying about the MD differences, and that's about having horizontal flexibility between specialties. I know an NP who works in GI, and he typically deals with acid reflux, GERD, issues with people's colons, and that's fine if that's what you want to specialize for your whole career, but being a PA will let you move between these specialties when you want. The second key strategy for answering why PA relates a little bit to the first. Besides comparing PA to other healthcare professions, it's important to show the career as the intersection between practicality and passion. Sometimes people's career motivations can entirely be driven by passion, but that's not really the case for a physician assistant. The practical considerations behind choosing the career, like a work-life balance and a shorter training timeline, these things simply can't be ignored in your explanation, or you won't be able to distinguish PA from other options you could have chosen. However, you don't want your why PA answer to sound so practical that it could be misinterpreted as something like being a doctor is too hard, or I don't want to go to school for 7 years. That's why I'm a big proponent of this practicality meets passion duality, where you try to show the PA career as the best of both worlds. This strategy creates a great sense of totality for the reader and has powerful rhetoric in convincing them that you are really meant to be a PA. The third and final strategy for answering why PA is what I like to call the selfless, selfish dichotomy. Most why PA reasons I see are just selfless, and they might sound something like this. I want to become a PA so that I can protect the underserved and help them restore control over their health. That's not bad, but it ignores a critical component, which is how being a PA will fulfill and stimulate you on an everyday basis. Very few PAs spend their entire career just being selfless. So your reasons will seem unrealistic unless they're complemented by your own self-interest, which could just sound something like this instead. Becoming a PA will allow me to protect the underserved and help them restore control over their health, which is what I see as the most fascinating and fulfilling way to pay back the life-saving efforts of the clinicians in my own community. Just by adding those words fascinating and fulfilling, we can better see how the career will stimulate youth. Those aren't particularly selfish reasons, but there's a lot more personal relevance behind your motivations just by adding those few words. So try to put a little bit of selfishness into your YPA reasons to see if it can make them more convincing. Obviously, you don't want your reasons to entirely be selfish, but that's rarely a problem in the PA candidates I see. And if it is a problem, they probably shouldn't be PAs in the first place. If you want to see how these 3 strategies can work inside your essays, check out my blog post that I wrote about the topic, which includes template examples for each of the 3 strategies that I discussed today. Do you want help crafting your perfect YPA response? Do you want to know your chances of getting in? Do you just have questions about where to apply? Feel free to book a free 1-hour meeting with me through the link below, and we can discuss all of these questions and decide whether we're a good fit to work together. Best of luck with your application, and I hope to hear from you soon.